What do you think the role of social media can play in influencing the behavior of the health sector? We wanted to know the answer, so we asked you.
I think it can be huge, not only in terms of our colleagues communicating, I'm a physician as well, but also in terms of the public and other members who have health issues and families communicating, sharing their information. I think one of the things is I always thought, there's Facebook, we should have something like Health Book, where we can put up our information, we can access proper information sources that are reliable, and to the degree that we want to, share it with others. And I think it'll actually get people excited about their health and staying healthy and fit.
No, I think that social media is a good way for people to spread their feelings and their thoughts about, especially healthcare IT, like computer systems at the hospital. Like I think if people who know about it can share what they understand about it, I think there's be less likely to be people as worried about, I don't know, some of the things that I think are illogical about maybe privacy. Obviously, I should be concerned about privacy, but I think people are maybe overly concerned, and social media is a good way to spread your influence, I guess, to people that you know.
I think social media could play a variety of different roles. One is that as patients, certainly they could bring about more patient engagement and more involvement in people's own health, and certainly for clinicians and other providers, social media could definitely play a role in getting people to kind of think about things differently and perhaps use technology in a different way.
I think social media can play two roles in the healthcare field. I think one, we can use social media to analyze data to figure out health trends and kind of do biosurveillance type stuff, and then we can also use social media to feed back information to the masses about what's going on around them in terms of healthcare and disease spread. So I think it can play a feedback role as well as an information type role for researchers.
I think it has a really important role to play. For example, Patients Like Me and Cure Together and other crowdsourcing websites have already started incorporating that idea of social media in sort of peer-to-peer patient collaboration, and I think this is something that can also translate to other areas of healthcare, and it's very important to try to go beyond traditional modes of communication. Tweets and blogs and text messaging are very legitimate and in many ways, in many settings, more efficient and more effective ways of communicating health information or health experiences, and ultimately influencing behavior change.